Now, I want to introduce from ACMC, now I'm going to try this and get it right the first time. Our guest today for the 9 o'clock hour is Dr. Sathish, so far good? Sathish Adigopula. How did I do?
You did perfect.
All right, Sathish, welcome again. My name's Jim, and I know you're kind of new to the area. We're going to talk about an appointment line. He's a pediatrician, children's doctor there, of course, we all know that. And he's brand new, pretty much, like you said, you only been here about a month now. Tell us kind of maybe your story of how you got here or what's going on in your practice. Then we'll talk about, I think your topic today is going to be childhood obesity. Glad it's childhood obesity for right now. Then we'll get on the topic for. Doctor, you want to tell us how you're here, what you're doing at ACMC, then we'll go right into your questions.
Oh, sure.
Glad to have you today.
Thank you. Thanks for having me here, Jim. Basically, I started off my practice in India, finished my graduation in India.
Really?
And went over to UK, spent a couple of years in UK.
And we just had the Olympics there, of course, in London.
No, it's a bit too early. I was there in 2003 to 2006.
Okay.
I finished my diploma in child health in UK. Then I moved over to Chicago, did my master's in Chicago.
Oh, okay.
Then moved out to New York for my residency, which I finished last year, or rather June of this year.
And how long does the residency last?
It's a 3-year residency.
3-year residency, and you did that in New York, you said. Okay.
So
now, now you're here with us. How'd you get over here?
Basically, I was looking for a place where I could start working and put down some roots, especially in a place which is not as impersonal as New York, but with a very good community, lots of community support.
Well, with Chicago and New York, you've been in some big cities, very, very busy, probably fast-paced, I imagine, and you use the word, it can get impersonal, I guess, in the big, there's just so many people, probably, and you're looking for a place where it's a little more community, lay down roots, like you said. And so how long have you been around at the hospital now with ACMC?
Been here a month and a half.
A month and a half. Just started your practice up.
Just started my practice, got a new house, and trying to set the new house up. So it's a couple of
trying to set the new house up. Now, are you, just to
months.
Get off on the side, are you a technology guy? Do you love internet and technology and tablets and all this, or what's your thing? What's your phone, tablet, computer? What do you like?
Mostly on the phone.
Okay, so you probably have a smartphone of some type.
Yeah, I have an iPhone, so it's mostly on the phone. When I'm in my house, it's mostly on the iPad or my desktop.
Now, can you run most of what you do in your practice even on these devices? Just for the modern doctors out, is that how they do it nowadays?
No.
Is it all at your fingertips all the time?
No, that's true. Ashtabula just now went live on Epic, which is an electronic medical record system.
Oh, okay.
And we have access to that system at house and using our phones as well. So we are connected with the patients and their records at most times. So if anybody calls us at any point of time, we have access to that system. And this system is connected to the Cleveland system as well, so it makes our lives much more easier and it gives better care to the patients.
So really, in this modern day and age, the technology is, you feel, as a doctor, a newer doctor and in our area, very helpful in keeping contact, because you can't live there all the time, and you're away at times. You have a life, or you try to have a life. I know you're setting up your house and all that, but there's a way you can read and check things, look at patients' records. The medical thing you said just came online recently. So a lot of times we abuse technology and do wrong things with it, but this is something I think probably very helpful.
This is not just helpful for the doctors, it's helpful for the patients as well, because we can provide better care to the patients with...
Why do you say better care? How? How does it make it better?
We keep our information at our places at all times. So if I do want to cross-check some information about somebody who who's called me, I have the information on my phone.
Wow.
So I can, and it's a very secure system. There's
lots of passwords. Okay.
I have to put in at least 2 different passwords to just get into the system.
Okay.
And then every time I make some orders in, I have to put 3 different passwords in. So it's a very secure system, and it makes life better for both sides, the doctors and the patients as well.
Well, you're not actually in a file cabinet looking through files. I mean, you probably can do that, but that's not something you have to go, I got to go and look at the records. A lot of that will be at your fingertips, probably.
Yeah,
I mean, you probably have some of it, but...
Handwriting is much better because it's typewritten.
It's typewritten, so it's very readable, right? Because I'm a terrible... Oh, boy, don't get into that.
You should see a few doctors' handwritings.
Yes, we've seen the prescriptions, doctor, on the pads. What does that say? And somehow, I've always wondered, maybe you'll tell me this before you're gone today. I'm getting so far off topic, but you're fun to talk with. how did the pharmacist know what you guys wrote? When we were looking at it and going, what does that say? They look at it and go, oh, 30 milligrams, da da da, and they type it in, and they know exactly. There just must be some shorthand you guys use between each other. So that's why folks are running, how does the pharmacist know if I'm getting the right medicines? They know what they're doing between each other, but to us it looks to us it looks gibberish sometimes. It's just fun. The doctor's appointment line, now you want to of course get set up. Are you singly kind of practicing your own, or are you with some other folks in what you do?
I'm with the group right now in Ashtabula.
Okay, and at the clinic, are you at, okay, your office at the clinic, 997-6980 is Dr. Adigopula's.
Oh, you got it.
Wow, I got to get a record for this twice already. Number 997-6980 is the number to reach him if you're wanting to think about pediatrics. Well, let's get into your practice here. You're at the clinic. We know where you are. You're new to the area. Are you enjoying the area so far from what you've seen?
It's a beautiful place, and it seems that everybody has lots of smiles for me, so it makes my life easier.
Even the kids? All right, that's great. Now,
most of the kids.
Yes, here's the topic you kind of brought up. We can go to anything you like. It's your time. If you want to switch gears, that's fine. And again, folks, while the doctor's here, we do take calls, just so you know.
Oh, sure.
593-7181 is our number if you want to talk to the doctor while he's here, any pediatric issues, or I think your topic of childhood obesity. Now, come on, doctor. Look, kids run around, they play all day, they're active, and they're eating all fruits and vegetables. What could be the problem? Of course, that's not true.
That's not exactly
What is America
true.
looking like today to you with kids?
No,
What's happening?
The statistics is, the numbers don't lie.
Okay.
So since 1980 to now, in the last 25 years, we've seen a lot of changes. In the last 25 years, the amount of obesity among kids, I'm not talking about the adults, which is slightly worse, but in kids, it has tripled. It has become 3 times
from
the
what
number.
it was when they started this in 80 to now.
Yeah.
Well, when you say obese, let's just get definitions down. What is a child that is obese? What does that mean in terms of numbers, percentages? What does that mean?
Percentages, in the sense, we normally use the height for weight.
Okay.
So if the every kid has to be a specific weight in proportion to the height he is at.
All right.
So it changes over time, but anybody who is between 85th to 95th percentile for his
And this is just
weight,
by like a chart you can look at.
charts, we could
So if they're 85 to 90%, what now again?
of his BMI,
BMI, which is body mass index,
body
right?
mass index.
Okay,
that's
there's a
right.
little configuration to get that number. 85 to 90%, what? How does that work
That
out?
would be overweight.
Okay.
Anything above 95 is called obesity. So anybody who's between 85 to 95 percentile is at risk of being obese.
So they're overweight to start. The term overweight applies there.
Over
the normal weight. Now, of course, children are different and build differently, but you're talking about they have to standardize these numbers for an average group of, you know, obviously there's bigger kids that might have more muscle mass. Who knows what?
True.
But for the average kid, you're worried about they're starting to be overweight to begin with because that leads to, it seems to tend to get worse.
Yeah.
Okay.
It's more like a vicious cycle. Once you are obese, you don't have as much energy, you don't do as much physical activity, and when you're not doing physical activity, the only thing you do is watch TV or play video games. And
We were talking
usually
about
when
video
you're
games
watching TV or playing video games, you try to munch and get some extra food in.
Boy,
So
this doctor
it's a
knows us
vicious
Americans.
cycle.
So we sit and watch TV and munch. And we're not necessarily on the bicycles watching TV, are we? We're sitting on a couch, or what do they call us? Couch potatoes, probably. But I mean, you know, it is, you got to admit, I suppose, and people that have called in the show, we have a lot of older residents here in County, retired people, and they'll call in and talk with Pat on his show, and, you know, you talk about the old days. It seemed to be, and I suppose a lot of it has to do with tech, that's why I say technology can be used good or bad, and it's how you use it. It's not that it's bad in itself, it's how you use it, I think. Probably in the old days, not as much inside things to sit and stare at, like the TV, which Americans, you know, love. You're outside, I just hear they played a lot more outside after school. You know, you stayed home till the lights got dark, or you got called for dinner or whatever. But you went to school and played some, and then after school you're either in sports or in your neighborhood baseball or running around with kids. There was a lot more activity, I guess.
True.
So we kind of have to now, you're saying purposely, plan physical activities because we don't do it as often, I suppose.
Absolutely.
What's your thoughts?
You're absolutely right in saying that the physical activity is not so great, but again, numbers show that kids have not lost touch with physical activity as much as we think. The main problem lies in the input, the amount of food that we eat and the quality of food that we eat. The
When you say food and
portions
quality, now what do you mean by the quality?
quality in the sense we eat much more of fried food and lot more of sugary
They
food.
taste so good though. Am I right? You know what I mean? Why is that something that so appeals to us when the other foods are good too, but you seem to get this mindset in your mind as a kid, maybe even more than an adult, I don't know. Vegetables, just they won't taste. Well, why do we assume that till you try them? Some are wonderful. Why? It's just made. Do you think it's convenience, or why do we get into those
multiple
fried
issues?
things? You know?
Multiple issues that go with it. Our body, I mean, human life has been designed in such a way to get the most amount of energy from any source because we have always faced hunger.
Okay.
In the last 200 years is the time when we have got surplus of food. But before that, we've always faced hunger, and we have been designed to crave for the high fatty food so we could put something off for our stores.
Okay.
But having it said that, now that we have better food and availability, we are still looking for high fatty food and food with more sugar in it to put off for stores. Now that we don't need so much stores, we're still storing in more food as fat. The sugar that we take, everything that we think is sweet has lots of sugar in it.
Okay.
And all the sugar doesn't stay as sugar. It just, if the sugar is not used for a physical activity, it gets converted to fat.
Okay.
And it's not just excreted because our body wants to store it for so-called rainy day, which generally we don't need so much in our body. So all the sugar gets converted to fat, and it's a vicious cycle. Again, the fat stays in the body because it's not used, and we keep adding more sugar in to the pre-existing food.
I know you have some set questions I want to get to, but things are rolling with me here.
Yeah, you're doing fine.
I don't want. Thank you. And we'll take a break in a minute here, just to break up the segment here in a minute. But while we're still on, and it's not a blame game thing. Look, we Americans have a lot. We're a rich nation. We have a lot of things. We enjoy a lot of things. Food is one of those things that Americans enjoy and have fun with. But basically, if we're talking about two things I want to mention, if you agree with this, if we're really talking about down to the basic bottom level, everything you're putting in your mouth, food or drink, really is to be fuel for the body to use.
True.
But we enjoy, it's not like we're just eating some pablum that's got nutrients in it, and we like different varieties of food, the flavors, the smells, the getting together at a table and having a meal together, special occasions. Hopefully people still do that. I believe in that a family needs to eat together. Today it's not maybe 3 meals a day together, but at least a meal where you get together, talk, and around a meal, or maybe some adults go to a nice restaurant and have a good conversation over a meal. So we relate food to good feelings, I think, as well as the nutritional end. Do you feel that's true here in America and they're getting all over the place?
Just before we started, I said the quantity and the quality of food. We haven't gotten into the quantity yet.
Right.
The portions of food have gone enormous.
As compared to what we used to eat in size of foods.
Yeah.
Okay.
The amount of food that everything is supersized. It makes it cheaper for the companies to sell it.
Okay.
And since we get it, we just have to finish the full bottle of supersized drink, or we have to go through the big chunky burger because it's supersized and we got it for our money.
All right.
We have better value for the money, and we just want to finish the burger or finish the drink and finish the the box of popcorn. The trouble is we just want to finish the whole thing when we don't really need to. It's the quantity of food as well.
So the amounts have changed dramatically, and for children as well, because we're talking about children specifically with you, doctor. But before we go to break, here was my second point that I was going to bring up. Maybe, because we love our foods, and we love to gather around and talk and eat and enjoy. But it basically really is for giving nutrients to the body if we're going to be at base level. All right, with children, and this is where I say I don't want to play the blame game and get guilt going, but where does the problem lie that children are eating too much and too bad of foods? Is it the kids' fault? How do you work with that? Do you ready to work with parents in your practice? Because I'm assuming most kids aren't working jobs and buying their own food. Now, they may have a couple bucks and go to the store and buy a pop or buy some snack, like kids have always done. But the basic meals they eat every day or foods they have access to at home, where does that responsibility lie, honestly?
The responsibility, I would say, lies with the parents and the grandparents.
Whoever's taking care of the children, because they're in charge.
But the trouble is, even the parents and the grandparents have been forced to see a lot of commercials which they believe.
Okay.
A lots of stuff says, most of the commercials for kids is kids having soda, kids having pop. Everything has sugar in it, which the kid doesn't need. We grew up drinking water. I don't think
Do you still promote water's the best thing for the body?
Water's the best thing. There's no added sugar in water, pretty much. And we don't need added sugar in water with the amount of sugar that we get elsewhere. We don't need added sugar in the water. It just makes it more tastier and easier for the kid to drink. But just because it's easier for the kid to drink doesn't make it any better. But having said that, all the commercials show the soda and the water as an energy drink, or making the kid do better at sport, making the kid do better at education. It's not so. I mean, commercials are there to push a product. I don't blame them. They have to do their economy too.
In other words, we're bombarded with advertising. And I'll even say this, and I'm not, again, not a guilt trip, but I saw Olympic commercials where, and I think it was for a certain soda brand, I won't even mention which one, but all the Olympic athletes, after they got done with their workout, the big bottle, and I mean, that's their choice, that's fine. But obviously the message to me is, man, those guys are superstar athletes. They're drinking this stuff. In other words, I'm not saying those words, but it's just the pictures there.
That's for
people
you
I
and
like
me.
and know drink this stuff. No, I'm going to do it.
True.
You know,
that's for you and me. And for an impressionable kid, it's even more easier.
Oh,
for
that
him
guy's really
to,
cool.
He's cool. I have to be cool. So what's the factor between us? He drinks the same soda. I drink the same soda. Let me.
And he looks healthy. He's in Olympic events. It must, But what we're also saying is, even if, doctor, and everybody's going to probably splurge sometime, but it's that we drink it all the time as our beverage. Not a treat once in a while. Probably, maybe your day. I know my day for sure. We had dessert or treat or whatever, but it wasn't like we lived on them for 3 meals. 3 Cokes for every meal.
True.
I didn't mention the name, but it's sodas for every. It was more. It was a Friday night. We had popcorn, and if we watched something on TV, we might do that. Because you're spreading it out, and it's not just concentrated sugar in your body all the time.
No,
and you're saying, is that what
moderation.
it contributes to that extra? Just fat is extra sugars not being burned off.
No.
So
the sugar just gets converted to fat. And again, as you were mentioning, that was the right point. Everything in moderation. I'm not saying that certain food stuff is to be banned. Certain food stuff shouldn't be eaten. Everything can be eaten, but in moderation.
Well, I appreciate hearing that from a doctor. I appreciate it. Just moderation.
Everything in moderation, especially if you're not at risk. If you're already overweight, you have to cut down on everything. Pretty much most of the fatty food and the sugary food to come back to the healthy level. Once you're back into the healthy level, probably you can do all foods at a moderation. You can have treats, it's not a problem. But again, a treat
but you don't live on those.
Yeah,
is the
a
point,
treat
right?
is not 12 chicken nuggets. It's probably a couple of them. But again, as a treat, you can't do that as a meal.
And and the idea. And you know what probably is? Do you think kind of our culture now here a lot? You've been in the States for a while. We're parents a lot of time. Look, we got a lot of retirees, but a lot of parents with kids. You're busy. Today they're maybe both working because you have to have the income to stay alive today. So what's fast and convenient? And we had another doctor on a week ago just saying the same thing. Sometimes you have to sacrifice the fun stuff for something you really need. You have to be willing to give up maybe those convenient. It's convenient to go grab the meal in a bag with a drink instead of taking an hour to make one at home. I don't have an hour, so I'm going to go do this instead on the way. And it's convenient. And I think Americans, I'm sorry to say, we're very great. I love America, but we love convenience. You know what I mean? We can be lazy sometimes. So
No.
We love that stuff.
I'm starting to like you. You are bringing out points that I wanted to discuss, but it just slipped my mind. You did mention the convenience aspect of cooking food. And food stuff, right now the situation in America is so bad that organizations, including the government organizations, have specific recipes on their website to show how to make the same old food from the past, but at a shorter period of time. You can cook within 20 minutes, cooking within 30 minutes. There are lots of recipes out there. I'm planning to put some of the links up on the Facebook of Ashtabula County Medical Center. I'll do that. I'll get back to my guys and we'll do that. So people can access that through our website as well.
Okay.
That is one. So it's not just the time factor. It's the factor that we don't know that we have these resources.
Okay.
A lot of resources are available, but we don't know that we have them. We have resources available in Ashtabula that is not so commonly known to kids. I've seen a lot of kids in the last 1.5 months. When I'm talking to parents about the resources that are available right next door to the hospital, they don't know that.
Really? So information is going to help too.
Information is power. If you know what you're supposed to do, if you know what you're supposed to eat, and if you know the resources that we have which could help you, it makes it easier for us to go through that.
Okay. The practice number for the doctor, if you want to get a hold of his practice, he is a pediatrician, and we're going to talk about a couple more child issues and just things you're seeing in your modern day practice with kids. 997-6980. 997-6980. If you want to mark that down and just keep it on the side, is the doctor's number. If you call that, they can talk about like appointments or things of that nature. Maybe real quickly before you get into your topics, just what's the scope of your pediatric practice? What kind of age groups are you hitting on exactly, if there is a range, and then what will you do for them or their parents as they come in?
Basically, it's from birth up till 18 years. That's
okay, so you get that full span. Okay, all right.
We do mainly the well-child visits and the sick visits.
Oh, okay.
Usually we have the kids come into the clinic regularly to do a check to see if they're growing fine, developing fine.
Okay.
And to talk to the
that
parents
normal
about
thing we call the checkup. You kind of handle all this. Okay, that's all right. And what else now?
And all the kids having any health issues, any health, mental, social issues could come to us.
And you've got references to take them if those things come up that you need to divert out of your practice a little bit and go somewhere else. You've got the resources to do that.
We have the resources in the clinic.
Okay.
And if we do have any more resources that we need, we have the resources from the Cleveland Clinic who assist us as well.
Excellent.
But most of the subspecialties is present in clinic, and few people do come into the clinic from Cleveland Clinic to have their practices here.
Okay.
So it makes life easier for us as well.
All right. Well, we've heard a lot. Thank you. Heard a lot about in the last year or so or more in the news this childhood obesity. They're saying that just children are bigger than ever before. And you've shown some studies that say we're in that overweight to obese category more than we've been 25, 30 years ago when you were looking at well, not you, but doctors were looking at these things. And some of the changes are just, and I think you mentioned two big things. And you know what? Everybody watching knows this. Food quantity and physical exercise. They can call in and tell me you got to exercise more and maybe eat a little less or eat better foods along your day. But like I said, sometimes you just get into the bad habits and they become your daily routine. And then all of a sudden a year goes by. Why did I put on so much weight this last year? What did I do differently? Or what did I stop doing I was doing? And so when you're talking, I think when you're talking with children, your fear is sometimes we're used to seeing overweight adults, 30, 40, 50 years old and older maybe. But if the kids are overweight or even obese, which gets to that dangerous category because some diseases can start to, like, what are some diseases that kids are at risk for when they're fatter, heavier, at a younger age even? What are we looking at? I mean, diabetes is probably one of them.
Diabetes is one. High blood pressure. We are seeing a lot of kids coming in with high blood pressure.
Kids?
Kids, yes.
Isn't that amazing?
Younger kids. Before 10 years of age.
And you said that is weight or food related many times.
Mostly weight related, food related, and the amount of cholesterol and fat that is in the body.
And you think they're just only so many years old. How did they build up that much so fast? I mean, it sounds amazing.
It just keeps adding on. As we mentioned earlier, the fat that is in the body has nowhere out to go other than get dissolved as physical activity.
Okay.
So the more fat you absorb, the more fat you put in, there's not much place for it to go.
All right. And what other things do you look at?
We see a lot of kids who come in with obesity, having sleep apnea. They're not able to sleep well and having problems with sleep. They come in with joint problems because they're overweight and the body cannot physically lift so much.
So even in some kids, there's joint pain with the extra weight, even at that age. Because I know in adults that, you get in arthritic things or osteoarthritis or putting a lot of weight. If you start jogging or running and you're heavy, you're a lot of weight on those joints, even in kids.
Yeah.
Wow.
And we have liver problems. It causes fatty liver.
Now, what is the fatty liver definition? I mean, I've heard this term. What's going on if you have that?
Basically, lots of fat gets stored in the liver, and the liver does not act as it's supposed to be, so it's not able to process.
And that's our blood cleanser. I mean, the liver keeps us clean.
Blood cleansing is not done as much as it's supposed to be, and it's again goes back into the vicious cycle. Liver is one of the organs that has to process the fat.
Okay.
And if it is not doing its job well, it's going to make life
now
worse.
Is fatty liver something? You can reverse that? I mean, can it go away?
It's reversible to a limit.
Oh, okay.
Usually with kids, it is mostly reversible because they haven't had so much of
Their youth helps them a little bit.
helps, and they haven't
Okay.
had so many years of damage onto the liver for
Okay.
it to be not reversible. So
But
it's
even in
most-
kids, some of these things, you're thinking about adult onset diseases. Wow.
And one more thing is most of the kids who have obesity also have psychological problems. They are being bullied in school.
Well,
They
you
have the
probably see some
problems
of
with
that,
bullying,
probably, yeah.
and they go in for depression. There is a study which shows that obesity has a direct link to suicidal ideation too,
Really?
which is not the greatest. We don't want our kids to kill ourselves.
No.
And obesity, I would say, is effective and a very slow way of committing suicide. I don't want to say it is, but is it?
Well, but as a
Truthfully
doctor,
said.
you got to be truthful that it's not good for you. You're harming yourself the heavier you get. I mean,
Yeah.
it's just sort of harming your body.
Yeah, harming
You're
your
just being
body.
truthful about it.
It's a very slow way of committing suicide.
Wow. That's, you know, and it's funny that you just think young people in your mind running and playing outside all the time. It just, if they did more of that, and
No,
it sounds so easy.
True.
You know, what about physical activity?
Physical activity, we in Ashtabula County have a lot of resources. We have a couple of good parks where
Okay.
kids could go and have the physical activity. We have a couple of good programs too. In the Premier Health Center, which is right across the Ashtabula County Medical Center, we have a program for young kids for called the Kid Fit. It's called the
Okay.
Kid Fit program, which is 8 sessions over a period of time where we have a trainer who trains the kids to go through the physical activity, and we have one of the doctors from the clinic who is very much interested in the program. Dr. Kauenberg goes in there
Oh, I know
regularly.
that doctor,
Oh,
yeah.
yes. He goes in there regularly to socialize with the kids, give them tips as to how they are supposed to be doing, and probably I'll also try to get involved with the program sooner once I get my
Wow.
feet stabilized up here in the
Sure.
clinic.
But that's a program, cost to it? Is it, I mean, you
It's
have to
8
sign up and check it
sessions
out. Okay.
for $24.
And they
so-
train you how to do certain physical
Yeah.
things. Now, are you a proponent of kids like playing school sports? Is that a big thing for you? What are ways kids can get out and do more than they're doing?
Kids need at least 60 minutes of physical activity every day.
Okay.
And physical
Wow.
activity is not just walking around, it's activity which increases your heart rate.
Okay.
It has to make your heart rate go
Aerobic
higher,
activities.
making sure that, yes, absolutely, aerobic activity, any form of sport, any form of running around, that they're supposed to do it at least 60 minutes every day.
Wow.
Which is a stretch from what we're getting nowadays. The schools also need to be involved so we could get the physical activity in schools. Most of schools have PE once or twice a week. We need
Right,
to
and
have
you
it-
really, to be honest, if you're talking doctor speak, it probably should be every day, but of
Every
course,
day.
how do you make that happen? And one of the things is, you know, just off topic, but I mean, schools, when they have to make certain cuts because of money, music and sports and certain things, sometimes those are the first to go, just because they're probably easier to, or not that people want to do it, but, well, we could get rid of this, we still have our core subjects we have to teach. So schools probably, you wish, could even have more activity on a daily
schools
basis.
is a very good resource. They could possibly have daily activity, and most of the kids have at least 1/3 of their meals in school because they have
Okay,
their
true.
lunch in school.
Yeah, true.
For sure. And we need to cut down on the amount of soda and amount of commercials they get in school.
I think some of the schools have tried to cut
cut
some of
down,
those like
yeah.
sugary pops and things.
Sure.
I believe a lot of them have done that
A
in
lot
areas.
of schools in Ashtabula have cut down on the soda and the sugary stuff they can get in school, which
It's
is very
available
good
at
news.
school, yeah.
Which is very good news. But the rest of the country still has to follow Ashtabula in that end. But kids still do take soda into the schools
sure,
from
bring
home,
it
so
from
that
home.
needs to.
So we got to watch really
cut
that
down.
excess sugar. Would you say of anything you can change in a food diet for kids? If you're regularly consuming, would sugary drinks be your first thing to change more than even solid foods, or is there
I
a
would
food worse
say
than sugary pop maybe?
Two things. Two things is the most important things. One is totally remove sugar from the drinks. Just
Okay.
drink water.
All
Water
right.
is good enough for every one of us. The rest of the salts we can get from the food.
Okay.
The second thing is all food in moderation. You need to have a specific amount of food to eat.
Oh, you hit
can't
up
go
that
back.
portion thing. I think maybe you wanted to, what kind of portions are,
Portions
just to
is,
throw a few regular, what would be regular portions compared to our huge meals that you're talking about? You know, so
don't
we get an
fill your
idea.
plates.
Okay.
Don't fill your plates.
Just load them up like a buffet.
not
Hate
load
to say
them up.
buffets are bad places then probably.
And yeah, buffets are bad
Because we can
places.
keep going back, right?
Not just that, we keep going back in our houses for a second helping.
Okay.
Most of the food that we prepare in our houses are good, but that does not say that we have to go back for seconds. We can go back for seconds tomorrow, not
Okay.
today. Make sure at least half of the plate. Once you take a plate, half of the plate has to be either fruits or vegetables.
There's something you can think about doing.
Yeah.
Colorful foods on
Colorful
half
food
the plate.
as half the plate.
Okay.
And the other half that we have is mostly grain. It's
Okay.
either wheat or rice, but if you have half of the plate as grain, at least half of that half must be whole grain.
Okay.
So if you're having bread,
So like breads or something
bread,
like that.
try not to have as much processed food as possible.
I've heard that where the processed food thing is a big thing with doctors.
Yeah, it's mainly breaking down the complex carbohydrate into simpler sugars.
And there's less nutrition in the processed food. Is that the deal?
It's not the less nutrition, it's
Okay.
the nutrition which is easily available for the body, which makes it easy for the body to store it into the
Okay.
side.
All right.
So we are not spending enough energy getting energy. So basically, when our body gets energy from food, it has to spend some amount of energy to get the food.
Okay.
But when we break down the food to simpler sugars, it makes it easier for our body to absorb the sugar faster
The sugar part.
and store it as fat faster.
So we're not even, when we're eating foods, working our body out as much
No.
as we could with regular foods that are good. Boy, that's
True.
amazing. The simpler foods don't even take as much work to break down.
True.
But then they're all sugar. Interesting. So sugary, portions, physical activity. Would you say the big three for
Big
kids?
three is those things. Physical activity, we have a lot of resources in the neighborhood
Okay.
which we could use.
And if somebody called your office, could you point them toward things? If
Yes.
they thought, I don't know where else to go, I'll call this doctor, would you be able to get them somewhere
I
from
think
there?
one other resource is we have a Facebook page for Ashtabula
Oh,
County
okay. Want to
Medical
give
Center.
that out just so people, a lot of people are online.
Just search for Ashtabula County Medical Center
Oh,
and
okay.
it comes up as the Facebook page for us.
All right.
We could start putting up lots of resources, including the links for the how do I put this? The recipe books which are
You mentioned that.
which are being put out by the government. Which it has specific recipes for everybody.
Okay.
It has Hispanic recipes. It has African American recipes.
So
it
even
has,
some cultural foods are in there as well as American food kind of a thing.
Sure.
That's interesting too.
So
Great.
we could put up those resources on the web for people to access, which might make it easier for everybody.
There's info available if we want to get it, is what you're saying. We can get to, we just have to know where to
It's
go.
all
look.
out there. We
That's
just
great.
have to get it out.
Doctor, thank you, and I'll say
you.
one thing, Adigopula. Thank you so much. We're glad to have you in our area. Glad you're willing to work with our kids and want to help them become healthier so they can become healthier adults as they grow. And that's your practice. 997-6980 is how you reach the doctor's office. And again, any information about appointments, checkups, wellness checkups, whatever they're calling them today, and you want information on some of this food thing, I'm sure he'd be glad to help you by calling that number, 997-6980.